All right, good morning.
Good morning.
And you had surgery when?
It'll be a year, like October 30th.
Great. And your starting weight was?
You know, I was, I think like 260. 260.
And now?
You know, I think I'm 160. I haven't been on a scale in a while, but 160.
Good.
And I'm really not losing anymore. Sometimes I wonder, well, maybe I need to lose more, but I feel great. You know,
Good,
if I can just maintain this. And it's just, doctors just changed my life. So I was in town. I just wanted to come by and thank you.
Oh, thank you.
Really, it really has changed my life. My husband said it was the best money he's ever spent in his whole life. Well worth it. And I've recommended it to so many people. It's just been a miracle for me.
Great. How about the supplements?
Well, you know what? I actually brought a list for you of everything I'm taking, because after a year I didn't know if some of the stuff I should start coming off of.
Right, and also you've got a problem, that low iron.
I do.
And so we're going to talk a little bit about iron, maybe answer some questions for you.
Right. Actually, the doctor said everything looks great. I had all the blood tests done.
Good.
Except he said you're very underwater on iron and you're actually anemic.
Right.
And so I've been on, in fact, I need to go back when I get home and take another blood test and see if I'm taking enough iron.
Right. So let me talk a little bit about iron and anemia. A few minutes ago, we were talking about the big complication in our surgery, which is ulcers and gastritis. But the other big complication is iron deficiency anemia. But I want to give you some epidemiology, some background on who gets it and why, and that'll help solve your problem of what to do.
Okay.
Almost 5% of our female patients get iron deficiency anemia. That's 1 in 20. It's a really high frequency. But what is the incidence of anemia in the American population who haven't had my surgery? In women, it's about 3%.
I had it before. It was,
right.
Yeah.
So my other question might be, what's the incidence of iron deficiency anemia in our patients who are men and in the general population who are men? And the answer is almost none of our male patients get anemic. And it's very uncommon to have male patients get anemia in the general population. So the high incidence of iron deficiency anemia is not 100% related to the surgery, it's related to being a woman. So when we hear about our patients who may have some iron deficiency, the very first thing we do is refer them to their gynecologist. Why? Because every month, if you go through your monthly cycle, you're losing iron.
Right.
So the very first thing is to use an analogy to understand your bucket of iron that's in your body, is we want to fill up that bucket of iron. But we cannot fill it as long as there's a hole in the bucket. So every month, with you losing iron in your monthly cycle, and that's why many women who haven't had the surgery are iron deficient. Not because they've had surgery with me, but because they're having a monthly cycle where they lose iron.
Right.
So the very first thing I would recommend to you, before you see your doctor, before anything else, is go to talk with your gynecologist. Now, since we're in public and things like that, I'm going to talk in general terms, but there are a variety of things that you can do to decrease the monthly loss of blood. One is you can take some of these new birth control pills where you only have a cycle 3 times a year. Okay, then you're going to lose less iron. There are other things that can be done, but the very first thing is to patch the hole in the bucket before you worry about taking extra iron.
Okay.
Because iron is so difficult to absorb, filling up the bucket by taking tablets is like trying to fill up the bucket with an eyedropper. So the very first thing is see the gynecologist to patch that hole.
Okay.
We want to decrease that monthly blood loss as the very first step.
Okay.
The next thing is, of course, we want you to take your supplements and take the iron, which you're doing. And oftentimes, once you've gotten this low, you need a visit to a specialist to get intravenous iron.
You know, I asked my doctor who's very conservative, who didn't want me to have the surgery in the first place. Now he's like kind of eating his words. But he said, he really didn't recommend that. And I said, how about let's just take care of this?
Right. There's a big article in the New England Journal of Medicine that many American physicians are too conservative about recommending iron. And there's a good reason for this. In the past, iron, intravenous and intramuscular iron, was tremendously dangerous.
Right.
We used to use, in the old days when I was a little doctor growing up, something called iron dextran. And iron dextran often led to anaphylactic allergic responses and had a high incidence of complications and death. The new kind of iron, which is called Venofer, 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 is now widely available. It's routinely given to patients every single day who are on dialysis.
Okay.
And the reason they get it is because they're on dialysis and they're losing blood in the circuit every day. So they need extra iron. And so we use Venofer in dialysis patients every single day, all the time. And those doctors, the nephrologists, are really comfortable with Venofer because they use it all the time. Lots of family doctors who are good family doctors who are kind of on the conservative side may remember from their training, if they're old like me, the old iron dextran. And there's a big article in the New England Journal of Medicine that I have published on our email mailing list. You can do a search for the word Venofer, and you can take a copy of that article from the New England Journal. It goes through the detail of when the different drugs are out there. But intravenous iron will boost you quickly, and then you patch the hole in the bucket, fill up the bucket, and then take your eyedropper to keep it up.
Okay. I'll do that. Good.
Now, you were going to go through your other...
Yeah, I'm still taking like the zinc sulfate for the hair loss. I didn't really lose any hair.
Good,
at
wonderful.
all.
Well, you took the zinc, that's good.
But do I keep taking it like for the rest
You
of
could
my
probably
days?
stop it now. You should have a zinc level in your tests. So I would check the zinc level. If it's okay, then you can stop it.
Okay.
And then check it again next year.
And then the creatine, I still take that.
Love the creatine.
Okay.
And taking the creatine is so good. And let's give a quick summary. There are a couple of videos on this, but I'll do a quick creatine summary.
Can I get my pen so I can make a note?
Sure.
Oh, thank you so much. Okay.
Creatine. First invented, it's a 3 amino acid peptide. Your body uses it to make energy for the cells to do things like in the muscle to lift weights and things like that. And it came to prominence when a guy from Nottingham, England, gave it to weightlifters. And the weightlifters got more strength and bigger muscles if they took creatine. Why do you care about that? Well, a lot of your weight loss in the past year has been muscle. We don't want it to be muscle, but your body is not good at burning fat. So when you lost your 100 pounds, that was 100 pounds that included a lot more muscle than we wish. If we have our patients who are weightlifters and they do bench presses, they all tell me their bench goes down after the surgery with their weight loss because they're losing strength. We don't want you to lose strength. We want you to build muscle. And if you build muscle, as a corollary to that, you'll actually burn more fat.
Okay.
So we want you to take creatine because creatine improves muscle mass. And by improving muscle mass, your body will be forced against its will to burn more fat.
Well, do you know how much I should be taking?
There's no upper limit. But wait, let me finish. I have more to tell you about creatine.
Oh, wonderful.
Yeah. Besides that, they said creatine affects the energy system in cells. Maybe it would work on the energy system in brain cells. So they gave it to old men in nursing homes and then gave them crossword puzzles. And the old men who had creatine's brains worked better. They solved puzzles better.
I'm circling that one. That stays on. Okay.
All right. But I'm not done. Besides that...
We're going to go. Ben's having a baby.
Okay. Oh, congratulations. Good. The next thing is that they took head-injured adolescents with mild head injury and they gave them creatine, and it helped their brain injury symptoms. Then they took mice and gave them a stroke. Don't ask, it's a sad story. But the little mice had strokes, and the ones that got creatine had less brain damage, so it helps protect the brain. Finally, they took 2 groups of mice, and they gave one group creatine and the other not, just regular rat chow without creatine, and the creatine mice lived 10% longer.